Shoulder osteoarthritis causes and treatment. Shoulder osteoarthritis occurs due to the breakdown of cartilage and other tissues in the shoulder. Symptoms include pain, stiffness, limited motion, and grinding sounds. Several treatments can help alleviate symptoms. Primary osteoarthritis of the shoulder occurs gradually over the time with wear and tear. Secondary osteoarthritis of the shoulder has a more specific cause, such as an injury or infection. Watch on to learn about the symptoms and causes of shoulder osteoarthritis. This video also discusses treatment options. Symptoms of shoulder osteoarthritis. Symptoms of shoulder osteoarthritis can include pain and stiffness around the joint of the shoulder and the upper arm. Pain that may worsen when moving the joint. Pain that may worsen at the end of the day. Stiffened joints first thing in the morning or after sitting for a length of time. Crepitus, which is a crackling or grunting sound when moving the shoulder. Pain from shoulder osteoarthritis can come and go. It may last for a few weeks or months. And then there may be a period of time with little or no pain. The causes of shoulder osteoarthritis can depend on whether it is primary osteoarthritis or secondary osteoarthritis. Primary osteoarthritis tends to develop over time due to wear and tear. It most commonly affects people over 50 years old. It is also more likely to develop in people assigned female at birth. Secondary osteoarthritis typically has a known cause. It can happen as a result of injuries such as a sports injury or workplace injury, history of shoulder dislocations, rotator cuff tear, infection. Treatment for shoulder osteoarthritis is typically non-surgical. A doctor may recommend surgery if the pain is severe or not responding to non-surgical treatments. Non-surgical treatments for shoulder osteoarthritis may include physical therapy to improve range of motion, function, and strength in the shoulder. Non-steroidal anti-inflammatory drugs such as ibuprofen, aspirin, and naproxen to reduce pain and inflammation. Corticosteroid injections to reduce pain and inflammation. Applying heat therapy or cold therapy to ease pain. Surgery for shoulder osteoarthritis can include a procedure called arthroscopy. This involves removing loose pieces of bone or cartilage. In some cases, a doctor may recommend replacing damaged joints with an implant made from plastic, ceramic, or metal. Surgery for shoulder osteoarthritis is typically a last resort. A doctor may only recommend surgery if symptoms do not respond to other treatments. How do doctors diagnose shoulder osteoarthritis? To reach an accurate diagnosis, a doctor may ask a person questions about their symptoms, take a full medical history, and perform a physical examination. During the physical examination, the doctor may look for or test tenderness, pain, swelling or enlargement of the joint, muscle strength, range of motion, crepitus, signs of arthritis in other joints. The doctor may then order X-rays. This will allow them to look for narrowing in the joint space, any changes in the bone, and any signs of bone spurs. How common is shoulder osteoarthritis? According to the Arthritis Foundation, almost 1 in 3 people over 60 years old has some degree of shoulder osteoarthritis. However, shoulder osteoarthritis is not as common as some other types of osteoarthritis, such as osteoarthritis of the hip or knee. What are the risk factors for shoulder osteoarthritis? One of the main risk factors of shoulder osteoarthritis is aging. Primary osteoarthritis develops over time as a result of natural wear and tear. Certain factors may increase the risk of secondary osteoarthritis of the shoulder. This include playing overhead or contact sports, performing heavy lifting tasks, history of shoulder injury. What are the possible complications of shoulder osteoarthritis? Having shoulder osteoarthritis may lead to complications such as a limited range of motion. This can make it more difficult for a person to perform daily tasks. As with any procedure, surgery for shoulder osteoarthritis may cause complications. A doctor can discuss the risk of complications with a person undergoing surgery and answer any questions.